Well, hello. This is Steve Long. I am the CEO of Hancock Health and Hancock Regional Hospital, and I have here with me Craig Felty, who is our Chief Operating Officer and Chief Nursing Officer as well. And we're here to talk to you for a few minutes just about the pandemic and where we're at with our journey in COVID in Hancock County. And so Craig and I are going to just dialogue a bit as we talk through this. But, you know, I want to tell you, we are more than a year into this journey now, and we have had more of these conversations via Facebook Live and recorded videos and presentations and emailed reports. So, you know, there's just a few things to add. So, you know, Craig, it feels to me like as we are coming into May and June here that things are looking pretty good in terms of the numbers in Hancock County. What do you think?
Yes, I definitely would agree. We're definitely seeing some decrease in numbers after the recent spikes we've had, and we're seeing that on the outpatient side as well as on the inpatient side. So I think that, along with the really robust vaccine clinic that we've been having here and the really successful amount of people we have vaccinated, I think that we are truly nearing the end of this.
You know, one of the things that people ask me is really how many patients do we have admitted into the hospital at any given time with COVID? I mean, there was a point over the holidays where it was 20, 25 a day.
Sure.
What do we run now?
We're running about average about 3 to 5 a day, and we did cap off last week and a little bit of this week at 6. But we have as soon as those get discharged, and we're getting the numbers back down. The interesting point is that I don't necessarily know if it's more COVID patients, but the patients we're getting now seem to be a little sicker because usually it's our older population that just did not get vaccinated. So and they seem to be in the hospital a lot longer than what we have been in the past. But yes, we're definitely seeing a decrease, and we can't wait for the day when we don't have any.
Absolutely. So as I recall, during the height of the pandemic, and especially during the beginning of it, there were no good treatments. And then we came out with the monoclonal antibodies, and we've had a monoclonal antibody infusion center now for several months.
Yep.
And when last I heard, we were right at 700 patients, which for those that are listening would be one of the highest proportions of any hospital in the state of Indiana. So we're very proud of that. And we continue to do that, but that's really the only treatment that we have that is good for COVID. So prevention still is the key. Is that correct?
Absolutely, yes. Get the vaccine. Please get the vaccine. That is what is going to totally terminate this virus and get us all back to somewhat of a normal society. But definitely, continue to practice hand hygiene, continue to social distance yourselves, and continue to wear masks, especially anytime if you're in a really enclosed environment with a lot of people around you that you can't social distance. It's pretty much common sense, and that's kind of the reason why we really haven't had a flu season this year. Mm-hmm. Not only because it's been kind of overridden by the whole COVID vaccine, but because everybody really has done a great job of protecting themselves, and that's exactly the same thing you do for COVID that you do for flu. So that's why we've had a pretty mild flu season.
Well, that's great. So I'm going to help us dispel a myth that's out there, because I've heard many people say, well, we haven't had a flu season because those people have just been categorized as COVID. But we actually test for flu when people come into our clinics in our emergency room. Is that correct?
Absolutely. Yeah, we actually have we're currently using a 4-panel test, and that tests for flu A, flu B, for COVID, and then a test for what's called RSV, which is more common in children. So several of the offices that you go to in urgent cares, they'll actually be using the quad test, which will give us a yes or no on everything.
That's excellent. So it's pretty safe that we know who's COVID and who's flu and who's nothing.
Absolutely.
Okay.
Absolutely.
So let's kind of end up with a discussion of vaccines then. As you said, the vaccine is the way out, and we are very fortunate here in Hancock County that we are the 6th highest county in terms of the proportion of our residents that have been vaccinated. It's kind of amazing to see that, but part of that is because we have a vaccine clinic here that has now given a shot to more than 40,000 people. You don't know this, but right behind the camera here is one of the guys, Jason Wells, who is responsible for that. So we're looking at him and we're smiling and we're saying what a great job he has done, because that is 40,000 shots. That's more than 20,000 people that have been vaccinated entirely in our county. Yes. So how do you feel about the proportion that we're at now and where we need to get?
You know, I kind of mixed emotions. I feel like we have done a great job in vaccinating anybody who wants to be vaccinated, and that's, I think, the most important part here. But we still would love to get more people in order to get the vaccinations. Like we said, this is really, the vaccination is what is truly going to take us to the end of this. And the more we get vaccinated, the more that we get to that point.
Awesome. Well, you have heard it right from Craig Felty, the Chief Nursing Officer and Chief Operating Officer here at Hancock Health. So with that, we're going to just leave you and encourage you, get that vaccine. We still have places. You can walk right in and get it here at the hospital. Join the other, well, nearly 40,000 people that have had nearly one shot, or at least one shot in Hancock County. And together, we're going to end the pandemic. So with that, have a great day.
Thank you.